Blanchet House is a nonprofit social services organization in Old Town. They've been around since 1952, providing meals, clothing, and housing services, mostly for men. Now Blanchet House is establishing an emergency overnight shelter for women, which will be in the Pearl District at Northwest 17th and Lovejoy. It will be called Bethany's Room. Scott Kerman is executive director of Blanchet House. He's joined by Katie O'Brien of Rosehaven, which currently runs a day shelter for women and children. And both of you, welcome back to Eye on Northwest Politics.
Thank you, Ken. It's good to be here.
Scott, why is there a need for an overnight shelter specifically for women?
Because the tragic circumstance that we've had in our community for at least 6 years now is not enough places for women to go at night. We have a number of really great shelters in Portland for women, but these are often extended stay shelters that have really long waiting lists. And one of the things that Katie and I encountered, our staff encountered day after day, were women coming to us for services during the day, begging for a place to go at night, and we had nowhere to send them.
Katie, you provide that service during the day, so how are you going to be working with Scott and Blanchet House on this new venture?
We've always been in really close collaboration, just as peers and as agencies doing similar work. We really look forward to the opportunity to provide those wraparound services. So Scott's shelter, Bethany's Room, is going to be, an evening shelter, and people then can walk 6 blocks to Rosehaven, and we can provide the day service portion of that wraparound service component.
Will the numbers match up in terms of the people you serve during the day and the people you intend to serve at night?
Well, we're going to be able to sleep up to 75 women at night. And I know, Katie, that you're serving how many people during the day?
We're serving about 150 a day, and about 60% of that population is looking for shelter on a regular basis. We're seeing people show up in the morning who have been outside, have been through extreme trauma from just trying to survive on the streets night to night. So we're just really excited about the opportunity to have a consistent place people can go, which would allow us to consider other things people can do during the day to really move that dial.
Who is Bethany, and why is this shelter named after her?
Yeah, so thank you for recognizing that. So Bethany was a meal guest at Blanchet House. She had been receiving meals and services at Blanchet House for almost the entire time that I had been at Blanchet House and before that. And she was troubled. She had medical issues, mental health issues, and she was killed in the middle of the night, run over by a car, over by Burnside and Ankeny Alley. And it's just a tragedy, and she is emblematic of the violence and horror and terror that women in particular are subject to at night. Bethany's death was senseless. It was preventable, but at that time, we didn't really have places for Bethany to go. And she had been housed over time, but because of her medical and mental health situation, that housing was often unsuccessful, and she was evicted from that housing. And so this is really the human tragedy that we are confronting, is vulnerable people who had lives, before mental illness, before addiction, before homelessness, and are caught in this death spiral. And we just don't have enough opportunity to help them. And so that really just compelled us. It was the final straw, so to speak. And we said as an organization, we have to do this. Frankly, I could name this shelter after a dozen women who have been murdered, victimized, who have died tragic deaths. Bethany was the latest, and really the person that I just said, we have to do this.
When will the facility open, and what's being done in preparation right now?
Yeah, we're hoping to open the facility by late October, early November. We have some tenant improvements to do. We purchased the building, so it's ours, but we want to remodel and expand the bathrooms. We've just filed the permit with the city to do that, plumbing and other restoration work. Once the permit is approved, we can get the contractors in to do the work. And once that's done, we should be able to open. But, it just takes time to go through the permitting process and to get the subcontractors lined up to do the work that they need to do.
How much will this cost, and who's paying for it?
We are paying for it 100%. We purchased the building for $2.1 million. We're probably going to put another $500,000 into its build out and renovation. And then it's probably going to cost us maybe up to $1.5 million a year to run the shelter. So this is a huge lift for us. Running an effective overnight emergency low barrier shelter for women is not an easy thing. If it was easy, we would have had these shelters all over town for years. But we are compelled to take this on, and we are driven to pay for it. And we just have a generous community who have really responded with such positivity and enthusiasm for this project, and especially rallying around Bethany's story and the story of other women who have been desperately crying out for help like this.
Well, as I mentioned, this new facility will be in the Pearl District, and you've heard the stories about Pearl District neighbors having concerns about these types of facilities in their neighborhood. I want to make it clear that what we're hearing here is concern about another shelter project, not yours. But I imagine that you're still hearing some of these same issues. Take a listen.
I think what the neighborhood wants and what I would want is people to get back to living healthy and productive lives. And the great question is how to do that, especially when people are deep into a chemical dependency. And, there's no easy answers, of course, but what we want is to not make the problem worse and make it worse in our backyard.
I'd like to have you respond to that. You've heard these concerns, these issues, and how do you respond to those kind of concerns from neighbors now that a lot of these facilities are starting to come online?
Yeah, we've been in the Northwest neighborhood for 16 years, so this isn't the first time we've heard these concerns, but people also have concerns about people sleeping outdoors and in tents and in doorways, and I think this shelter solves for a greater problem we have. It isn't the end solution. And it's as good as the energy and the upkeep and the communication that we all put into making this work for the betterment of our entire community, and that includes our houseless neighbors.
What do you see on the street these days, say compared to like a year or 2 years ago? Are things getting any better?
I think they're getting more complicated, and I think to the extent that we can shelter people, we will have this kind of first level of stabilization that is just completely necessary in order to move the dial in your life anywhere else. When people are showing up at Rosehaven every day and they've either been up all night or coming to us and have been abused or their things are stolen, all we're doing is trying to kind of get back to a baseline. So if people have a place that they can go, a place that they could leave their belongings, they can come to Rosehaven and they can take a shower and get food and meet with our resource navigators to address all these other components of their life. So to us, this all is really, really hopeful, and that people will come and they will have this level of stabilization that will allow us to walk beside them in a journey to a healthier, happier life. And everybody in the community will benefit from that.
Last week, President Trump signed an executive order on homelessness, asking cities to involuntarily remove homeless people from the streets and into treatment centers. So far, there's no money attached to that executive order. How do you see that playing out? Will that fly in Portland?
Well, I think an initial concern is we know as a city and as a state that we don't have the facilities in place right now that we need to help people with mental illness, to help people with addiction. In fact, Oregon ranks at the bottom, if not dead last, in these services in the country. So this executive order is really out of touch with what we're capable right now of providing. And I think one concern is, can this be used as a lever to withhold funds because we're not able to live up to what's being required by this executive order. And so I think there's a lot of concern. We're already seeing a lot of effects coming from cuts and eliminations in federal funding. We've had budget cuts locally here in the county. Is this going to just further complicate what we need to do as a community to move people in our city forward?
Scott Kerman, Katie O'Brien, thank you very much for being here on Eye on Northwest Politics again, and good luck with Bethany's run.
Thank you, Ken.
Thanks.